Hi, everyone. Welcome back to Black Menace Survival Steps to Beat COVID-19 for African Americans. I have a wonderful guest with me today. It is Dr. Christopher L. Hall, MD, MA, former Army captain and physician with more than 15 years emergency medicine full-time. Dr. Hall is an alumnus of the California State University, Northwestern University, Fisk University, and the Meharry Medical College. Dr. Hall completed his internship in internal medicine at the William Beaumont Army Medical Center and a family medicine residency at the University of South Alabama in Mobile. He is the author of Ward of the Court and a national radio talk show host, and he also currently is working in the Delta area. Is that correct, Dr. Hall?
That is correct. Yeah, that's very correct, Ms. Edwards, and I'm very excited to be on your show here today.
Well, I'm glad that you're here with me today because, you and I have been talking for a little bit about us working together in radio and doing some things. And so when this opportunity presented itself, I just want to personally thank you for agreeing to come on the air with me.
My pleasure.
Wonderful. So for those of you who are new to us and you've just checked in today, I'm Nisi Edwards. I am the host of Black Menace. I'm also the founder and organizer of Fibro Patient Education and Support, my not-for-profit where we help people with fibromyalgia and chronic pain. And if you're wondering why the name of this digital series is Black Menace, Survival Steps to Beat COVID-19 for African Americans, I'll tell you why. It's because the coronavirus has largely impacted the African American community. Many other people in my community have perished, or either they're in a hospital, or either they have had a loved one who have died from this pandemic. We know that the coronavirus is not only deadly, but it is lethal to our community. And so that's what this digital series is about, to educate the African American community about the coronavirus, what they need to know to take better care of themselves. So Dr. Hall, share with us, what are some of the things that you are seeing on your end with this pandemic?
Exactly. I'm so glad that you asked me that question. And initially, when we started to find out about this virus, this is really back in December, when in this country, I think the administration started to find out things. And actually, let me think back. It's probably November, and there was very little action, from the current administration, from the Trump administration. And so the data was suppressed coming out of China, and it's because they knew what was coming. Okay, and so this virus eventually was got out of China. Okay, and there's some radio talk shows I've done about this. The origin of this virus. We know the virus originates or is seen to come from bats. However, we know that in Wuhan, China, they were doing studies, okay, on this virus, the MERS virus, that has 96 to 99% genetic homology to this current COVID virus 19. Okay, they were studying that virus. So the question is, is that something that was accidentally came from that lab, or is it more of the transmission from these animal markets in Wuhan that this virus basically was let free? So there's a debate there. Either way, we know that it comes from Wuhan, China. We know that they're testing in biological agents for war there in that lab. We know that's been known for years. So we have that virus that is comes from China. It ends up in Italy. Okay, it ends up in Italy. It ends up affecting a huge population. Italy, we see the mass deaths early on, and from there we see, we know that New York is a major port of entry so far as tourists that come from China and that come from Europe. Okay, and so that's where we see one of the major hits in New York. Okay. Now I'm saying all this to say to explain how this relates to the African American community, and how this relates is one of two things. First of all, how the virus enters the cell. Okay, we're very aware of how this cell. You can now today just look on the internet and see that. Okay, and it enters, we know, through what's called the angiotensin 2 receptor cells. Those cells are very prominent, we know, in bad cells, okay? And we also know those cells are very prominent in the lung, okay? In the blood vessels that line the lung, and also the cells that line the lung, okay? How does this relate to how it affects our community? And we'll talk about steps, what we can do to protect ourselves. But I want us to know how this virus relates to our community and why we're being affected at a higher rate than other racial groups here in the United States. And not just in the United States, also in the United Kingdom, okay? Humans of African origins in the United Kingdoms, the United States, and also other parts of the world are being affected by this virus. Okay, so again, let's go back to the angiotensin 2 receptors, which are, this is the actual protein or the opening into the cell that this virus gets into our body, okay? And so those are prominent in the lung, we know, and also on fat tissue, okay? Looking through the data the last couple of days and weeks, what I found, and anyone can look this up, okay? There's been articles in the Lancet, there's been articles in a number of prominent research journals where there's a clear relationship between hypertension and this particular receptor, okay? Is it that people with hypertension have more of this receptor in the lungs? And we know that obese people do, okay? And how does hypertension relate to our community, to the Black community? We know that hypertension comes from simple things as stress, okay? Anxiety, okay? The stress that people live under. We know that comes from the way we eat, okay? If our foods are a certain way, if they're more increased salt, those foods that are high in say, pork and those kinds of things, that can increase your blood pressure, okay? So this is very obvious and very clear. You see where I'm going?
Yes, I do.
That our community suffers from hypertension, and a lot of this hypertension, let me tell you this, Ms. Edwards, is that a lot of the hypertension in the Black community is undiagnosed. There are a lot of Black Americans walking around with undiagnosed hypertension. Okay.
Why is that? Because you have some of African Americans, I know, may not have an ongoing clinical relationship with their doctor, you know, where they go for like routine exams and whatnot. But what about those people who go all the time? And the reason why I'm asking that is I know some people who eat a lot of pork, eat a lot of salt, weight may be an issue and whatnot. And when I've had this conversation with them about hypertension, because I know that it's a silent killer, you know, heart attack and stroke, they'll say, no, my doctor never told me that I have high blood pressure. And it started to make me wonder, Dr. Hall, are they really having these conversations with the African American community?
Very good question. And so the diagnosis of hypertension really occurs over weeks, okay? It can occur with one episode visit of a doctor if you have blood pressure that's high enough and you have symptoms that are affecting the end organs. Those end organs being your eyes, the vascular in the eyes, the vascular in the heart, and your kidney. And so you have to have things like EKG changes. You'd have to have maybe some type of ultrasound status with high blood pressure, or kidney failure, acute versus chronic with high blood pressure for a doctor to put you right on blood pressure. So if the patient is not coming back over weeks, which really requires, typically it's three blood pressures over about 2 weeks diagnosed in a doctor's office. And these days, now when I started practicing medicine, that the limit was a little bit higher for people with high blood pressure. But today, that limit is somewhere around 130 over 70, if you look at the current data. So anyone with blood pressure that high over 3 visits, you know, can potentially end up with a diagnosis of high blood pressure. So again, in this current healthcare situation, we have sometimes where the patient's not seeing the same doctor. You know, we have situations where patients cannot get into doctor's office for 2 to 3 months when they call. And who's to say you're going to see the same doctor? So the healthcare system in itself, there are certainly a lot of inadequacies that contribute to this problem. But the main thing I want to point out is that high blood pressure, more than diabetes, more than kidney disease, whether it's acute versus chronic renal failure, more than those two, high blood pressure has been linked with severity of infection and death from this current COVID-19 virus.
Now, question for you: with hypertension, 120/80, are they considering that to be normal blood pressure?
120/80 is right there at the borderline now these days. That's kind of what I was pointing out. Yeah,
yep.
That's kind of right there at the borderline now. They're saying above that now that you're going to be in a situation where you're, you know, pre-hypertensive or where you have hypertension. If we can get 3 of those values averaged out over 3 visits, you're in, you know, looking at that plus labs, looking at things like your EKG to look at the effect on the heart, looking at your urine to look to see if there's any protein spilling in the urine, looking at those things. Plus 3 of those values is probably going to put you in range of hypertension. I'm pointing that out because as Black people in America and across the world, we live under extreme stress. Okay?
Yes.
It's real. Anxiety is real. Stress is the release of epinephrine and norepinephrine. Those are chemicals that are released from your body that cause constriction of your blood vessels and that speed up your heart. Those are real forces put on your end organs that create the environment where a patient now has hypertension. Your daily activities of going to work, the stress that you receive there. Let's not leave out the constant racism that we live under. Okay, as African Americans and as people of color here in America, certainly. Those are factors that contribute to high blood pressure. Now, understanding that, you probably can see why we are being affected at a higher rate, okay? That rate being for every 1 person in the non-white community who has severe morbidity and mortality from this virus, there are 5 to 7 African American people who have severe morbidity and mortality from this virus. And I'm telling you, I believe this is due to hypertension, most of it which is undiagnosed. And that, I think, is the main reason why we're being affected as a race.
So we are constantly, we know, under a great deal of stress. When I look at the situation in Minneapolis, that's a powder keg of stress. African American men, especially, you know, our target. I feel as though we have a bullseye on our back, you know, is always a target. And other people who may be watching this may be saying, well, they're stressed in other communities. Yes, you have your own stressors, but in the African American community, we have way more stress than you do. Now I'm going to mention this to maybe this will clarify some things for some people, Dr. Hall. Now, when the weather is nice, they all want a sun. They all want to get a tan because they want to be darker. But don't nobody really want to be Black because they don't want the challenges that come along with being African American or being a person of color. Now, when you're talking about that additional stress, think about those people families that may have lost a child due to some type of altercation with the police or gun violence or whatever. They are already under a lot of stress. You have young people predisposed to that. They're under a lot of stress. So I see where you're going with this about why we are largely impacted.
No doubt. And the main point is to get across the importance of stress. That's one factor, but it's a big factor that we live under. You know, the stress that we live under as a people, trying to do our best in this society, trying to be the best citizens in this society, trying not to be prejudged, okay, trying to live safely and drive safely through these communities, jogging through these communities, or whatever we may be doing. Just the thought that, hey, something happened to our families or to ourselves is very stressful. Now, there certainly are other factors. Again, we talked about obesity. So again, the diet, the way in which we eat, okay, the types of foods that we eat, you know, that can help us get to ideal weight, help us decrease obesity. Again, the fat cells are another place where you find the angiotensin 2 receptors in high amounts that the virus enters the body through, okay? And so that's the whole idea of trying to get in good shape, you know, for us as the people and as a nation, really, to try to eat the right things and to try to get in good shape. Now, I do believe that we're going to find that high blood pressure, we already know, has a relationship with this angiotensin 2 receptor, but I think we're going to find that there's probably some type of upregulation of these receptors in people who have high blood pressure. They're going to find out that high blood pressure, they have higher number of receptors. I can't say for sure that high blood pressure upregulates these receptors, but I do know that hypertension is tied more strongly with death from this virus than diabetes and also than chronic renal disease. So again, think about our diet, where our diet comes from. Think about the contributions, really, and we need to talk about this stuff. We can't shy away from real stuff in life. People are dying, okay? Let's talk about real stuff. Let's talk about slavery. Let's talk about what we ate in slavery, how that diet was passed down through the years, okay? And so we see a conglomerate of factors that are affecting our community, whether it be the effects from slavery, whether it be now the current stress that we live under, okay? And again, a lot of experts have said across the country that this virus is really helping point out the disparities in the healthcare system and how it's affecting African Americans here in this country.
So, oh, absolutely. And then when you mention about slavery and the diet passed down to us, for people who may not know this, during slavery, we didn't have say-so in what we wanted to eat. It was whatever was remaining that was given to us, or what was left over. That's all that we had. And think about in some of our African American communities where there is a food desert. They don't have, you know, grocery stores. They may have a little small store you go into that's going to be selling, whether it's cigarettes, unhealthy stuff, you know what I'm saying. And then to get to places where you can buy good stuff, if you don't have access to transportation to get there, you can't buy it. If you don't have the funds, you can't buy it. So that's another stressor. Because I really feel that many people do want to eat better. They want to live better. But if you don't give them the right tools and the resources they need, just like, for example, food stamps. When you think about, I don't know if you saw it on the news. I saw on the news with a lot of these farmers on the farms, they had all this food on the ground that was ripe, that they were not going to donate. It was just laying there. And I thought to myself, there's people around this country who are starving, Dr. Hall. Why not pick that up, donate that to those areas that need it the most? Now, when I mentioned about food stamps, unless it's changed, I remember before I would hear people say that certain things you can't buy with it. So you know how they have the farmers markets and different things? Why can't you use food stamps for things like that at the farmers market?
Very true. Yeah, very, very interesting. And so I really want you know, to get out the message is from a medical standpoint, you know, and being a medical doctor, and you know, my experience with this, Ms. Edwards, is many years. Okay, you know, I served as a captain in the Army and also as a physician. Okay, and also I've worked now in emergency medicine about 20 years in different areas all over the country. And so my experience when I talk about stress and when I talk about anxiety and how it affects people and their health, I'm not just making this up. This is from years of experience. Again, working around soldiers in our wonderful military, and also working in the rural areas and in areas where we have a lot of underserved people. So.
Yes, I understand. Now, I shared with you earlier that I have my own hypothesis on this. Is in terms of why more of us are dying, and this is just my own personal perspective on it. With the coronavirus, in the beginning, I heard people state that it doesn't impact African Americans, and they were talking about all the other people that it was impacting, Caucasian people and other people. Then when we started dying off in greater numbers, I noticed that when they would have at the White House, when they would have those daily briefings and they would talk about the numbers and different things, there really wasn't much of a focus on us. When we started dying in greater numbers, for me, it seemed like nobody really cared. And so my personal perspective on this is that people felt, well, if it's just impacting the African American community, we don't have to worry about that. As long as this virus don't come knocking at our door, we don't care. And people don't care. And, you know, as they say, you don't get it till you got it.
Yeah, very true. And this is clear as day what you're saying, okay? And the reason why is because we have a president who is letting us know that this is clear as day.
Yes.
This is a president who has created an environment, okay, of fear and not being a leader, okay, creating an environment where we're not safe.
No.
And now, against all the recommendation of leading scientists and doctors, even in his cabinet, he is refusing to wear a mask.
I've noticed that. And when he did have one on and somebody asked, you know, where was it? When he visited someplace, I don't know if it was Ford Motor Company, the plant, or some other place, he said that he had it on, but he had taken it off. To me, if you consider yourself a leader and you're the president of this country, you're setting the stage. So if you're wearing the mask, you're letting people know this is something serious. This is deadly. This is a pandemic. This is not something you should be playing around with. You need to take it seriously. But if you're walking out there and you're refusing to wear the mask, and even some people in his administration, his son-in-law, Jared Kushner, and some other people, in the beginning now they said it was just only a few people. Then they said when the weather improves and the temperature rises, it's going to die off. So from the beginning, he never took it seriously, and he's still not taking it seriously.
Yeah, and it's very sad because not only do we have a so-called leader there who obviously has not managed a pandemic, a deadly pandemic, has not managed it very well, has managed it horribly. You have the same individual who has created a society and an atmosphere where people think it's okay to chase people down the street and kill them in the street, a lawlessness environment.
Yeah.
An individual who does not respect science, does not respect humanity, and I think ranks as one of the worst leaders this country has ever had. So, and you know, Nisi, I can't hide behind what's going on. I have to tell the facts. I have to tell. I'm a doctor. I deal with people dying every day. I'm an emergency room physician, and so I have to tell the facts the way they are. And really, if you just look at it, you can see it yourself. I'm not making anything up. I'm not trying to sing out any particular group of people. These are the facts that we're living through today. And people don't realize it until you have someone in your family who's affected by a death from this coronavirus. But a lot of this stuff could have been prevented had we had better leadership, and had we had a leader that showed, that portrayed, hey, we should be trying to take care of one another, as opposed to just the other day I saw where he said to the police officers, "Oh, don't worry about rough handling people who you're taking into custody." Why
Yeah.
would you say something like that? This is way below an American standard. Our standards that we don't have in this country, it's way below, and it's very sad.
It is. And basically what it is we have a white supremacist that's in office.
Well, looking at his actions and the things that he's done, I probably I'd have to agree with you. So,
and the reason why I say that is because the white supremacists have claimed him as their very own. So if they're claiming him as being one of them, it is what it is.
Again, like I said, it's not something you even have to say or I have to say. It's kind of actions speak louder than words, and I think that's very clear. So, I think, yes, ma'am.
No, I was just saying, I was agreeing with you that is very clear. Yes,
it's very clear as day, and I do not get any joy out of giving out, that sometimes may be a little harsh and painful for people, but these are the facts. What I would suggest that we do here in the Black community is certainly we need to wear masks. We need to make sure that we don't end up in the public catching this virus and bringing back home to our wonderful and lovely and dear grandparents, parents, aunts and uncles who likely have things like hypertension and diabetes. I would suggest that we do the social distancing, that we stay 10 feet apart instead of the 6. I would suggest that we try to do those things that are going to get ourselves in shape, just going to get us to ideal weight, decrease factors that can cause things like hypertension, heart disease, obesity, and try to live our lives in a way that we reduce stress. Again, I want to make that point again about stress. Stress is very important in the etiology of hypertension. Stress is adrenaline. It's epinephrine. That's a chemical secreted in your body. Epinephrine goes to your heart. It speeds your heart rate up. It constricts your arteries and causes high blood pressure, hypertension, which we know is associated with what? The coronavirus and what? Bad outcomes. So that's one of the major points I want to get across.
That's okay. Got it. I mean, that's very, very clear that for us, everyone should be wearing a mask. But if they choose not to wear a mask for our community, we must wear a mask. You also said social distancing. Okay. Vitally, vitally important. Diet, nutrition, exercise. So basically, to me, this is all about self-care. You must take care of yourself. Take care of those in your household, your loved ones, your children, your grandparents, whomever. We must practice safe care. Now, Dr. Hall, tell us about your book.
No problem. Thanks for asking me that, Nisi. This book was written in 2018, and the book is called Ward of the Court. And if you can see it there, it's on Amazon, and it's on a number of different outlets. But the book details my life as a young child of age 4, is when I was first put in boys' homes and foster homes throughout the Los Angeles, California area. My dad ended up in a situation where he ended up in prison, and my mom, being very young at that time, had 5 kids, and it was very hard for her back in the 60s to take care of us. And so she ended up in a situation where she had her kids taken away from her. And I was put in the foster care system at age 4. And from there, was in multiple boys' homes, in every juvenile hall in California. And so I was a bad kid. But the book talks about how no matter how you're brought into this world, with whatever circumstance you may have, that if you believe in yourself, you work hard, respect your elders, believe in God, that good things can come from that. And so that's what the book is about. It details my experience through college, through high school. It's very detailed. It lists everything, my grades, my transcripts, my test scores, so that you can see that a person who was not early on a very good student, not a very great test taker, was able to learn those skills and do well, and again, in some of the best schools in this country, and to make the highest scores on standardized test scores. That's what the book is about. So I'm hoping that young people will benefit from it.
Yes, I need to buy some copies of your book. My apologies for interrupting you. I need to buy copies of that, because what you just described.
Lisa, I'm going to send you a book. I'll send you a book.
Okay, but no, I'm going to buy copies of the book, because there are many families that have experienced the same thing or are experiencing it now. And then the one thing that's definitely apparent to me is God had his hand on you the entire time, and he has blessed you tremendously. So for those of you out there who are watching Dr. Hall talk about his experience in his book, Ward of the Court, what I want you to take away from this is that God can bless you no matter what situation you are in. He can turn your life around. And look at Dr. Hall. It's amazing. And Dr. Hall, I would love for you to come back another day where we can spend more time talking about your book, because that's something that more people in our community need to hear about, because there are a lot of families who've been separated. There are a lot of families where the children may have been taken away from both parents, and they're there by themselves. Some of these places where they have been put in foster care or orphanages in different places, they may not necessarily be kept safe, may not be a loving place, but thank you for sharing that.
Well, no problem. I'm so excited about being on your show and about our new partnership and working on things that are going to benefit our community. So,
yes. Now you have the last word. What else would you like to share with everyone?
Well, the main thing is I want people. The main thing really is this book. This book is almost like a guide for young people. Everything is laid out. And my brother has a chapter in the book, Wayne Royce Timmons. He talks about what not to do. He is actually incarcerated for 1,300 years in prison. And
Wow.
he is writing from prison a whole chapter of what that life is like, how he's not getting out, and what young men should not be doing out here today that will get themselves in that situation. So that is everything's in the book. And the main thing is I'm looking forward to just being back on your show and working to make our community better.
Thank you so much. And you enjoy the rest of your day. And thank you also for your service to our country. And thank you for being part of Black Menace. I greatly appreciate it.